Hello all, welcome to Medsyno. I'm Dr. Arshad. In this short video, I gonna explain you about a bone age versus a chronological age in pediatrics. This is one of the high yield and repeated topics in pediatrics. First, we have to understand what is chronological age and bone age. If you ask what is chronological age is age of the person from birth till the present time. In short words, if somebody asks you what is your age, whatever is the response, that is called chronological age. Bone age is equal to skeletal maturity. As you can see over here in the maturity chart, we can able to find the maturity of the bone by the normal X-ray of the left hand, particularly by the wrist. With that, we can able to find the skeletal maturity. Why this bone age and chronological age is important? To find out the short stature, rule out the endocrine disorders, and identify the growth potential of the children. This bone age and chronological age is important. Let's try to solve some pediatric FMG question. 10-year-old boy present with short stature. His parents are short. Other examination seems to be normal. There is no delay in puberty. Bone age is equal to chronological age. Here everything is normal. Here the parent's height is short. The child is also short. So that's why here we are choosing this is the case of a familial short stature. Next question. 8-year-old girl present with early breast development, rapid height gain, bone age is advanced compared to chronological age. If you know the synonym for precocious means something is happening earlier, then you can come to the option of precocious puberty. Because here in the question they mentioned there is a early breast development and development of a secondary sexual character in this girl. So that's why here we are choosing it's a case of a precocious puberty. Third question. 14-year-old boy present with short stature, absence of secondary sexual character, otherwise healthy. Bone age is less than the chronological age. Here they mentioned short stature and absence of secondary sexual character. So something is delay. So that's why here we are choosing constitutional delay. Here, why we are not choosing familial short stature is there is no history of family particularly mentioned over here. So that's why here we are ruling out familial short stature. There is no typical symptoms related with the Cushing or hyperthyroidism. So that's why it's the both options are ruled out. Okay, the next question. 12-year old child present with short stature, fatigue, weight gain, and poor school performance, dry skin. Here, there is a history of short stature and some other pathological signs are given over here. So that's why here we have to think with our problem solving ability. Here we gonna deal with some of the pathological condition. Bone age is markedly delayed compared to the chronological age. So if you know the symptoms over here, dry skin, weight gain, fatigue, these are the symptoms of hypothyroidism. So that's why here we are choosing hypothyroidism. Why we are not choosing constitutional delay is here there is typical symptoms related with hypothyroidism. There is no family history given over here. It's not something happening forward. This is something there is a delay. So that's why precocious puberty is ruled out. Okay, here only 3 points you have to remember. What is in case of bone age is equal to chronological age, this is the case of maybe normal. There is a delay in growth and development, but the child is normal, or it could be a familial. In this case, what we have to do is we have to just reassure. And the another case is bone age is more than chronological age. This is the case of precocious puberty. And the third scenario can be chronological age is greater than the bone age. Here we have to know whether this is the case of mild or severe. If it is mild, this is the case of delay in growth. Okay, if it is severe, then we have to think about some of the pathological diseases. Like in the questions how we solved hypothyroidism, the same we have to think of some pathological diseases. That's all, guys. If you understood these three at the end, you can able to solve a lot of previous year FMG questions related with this. If you have any doubts regarding this, just type in the comment section. I will be happy to help you out. See you in the next one. Bye.